Um, Good evening, everyone. I am Dr. Amlantaban Mohammadran. We are today going to have a discussion on brain stroke. I welcome Dr. Bikash Mishra, Chief Consultant Neurology, Department of Neurology, Apollo Hospitals, Bhubaneswar. Welcome, sir. Sir, we are now going to have a discussion on brain stroke. So, we have a couple of questions. So, first we have to discuss what is brain stroke.
Now, when we speak about the brain stroke, it's actually like bolt out of blue. It is sudden striking and blockage of the blood pipe, or it's the rupture of the blood pipe to the supplying to the brain, and that causes damage to the brain tissue, which is called a stroke. This can be because of various reasons, be it the structural abnormality of the blood pipe, be it due to blood pressure, diabetes, and other associated reasons for which the blood pipes are getting damaged or they're getting atherosclerosed. Means your blood pipes are getting thickened and the cholesterol gets accumulated into it, or it might be because of the sudden rise in the blood pressure, it can rupture in between. So this is what it is all about a stroke.
So my second question is, what are the different types of stroke we have?
Well, it's a very nice question. If you talk about stroke, there are basically of two types. Either it's a bleeding or it's a clotting type, or in other terms, it is the hemorrhage or the ischemic stroke. The majorities are of the ischemic stroke, and a part of it comes from the heart, which is called cardioembolic stroke. The other are the thrombotic strokes, means the blood pipes are getting blocked because of the long-standing damage to the blood pipe because of the cholesterol-rich platelets getting plugged there, and then subsequently causing stroke. The other part is actually about the hemorrhagic stroke. What I said earlier was the rupture of the blood pipe. This can happen because of the various risk factors that we are going to discuss in the next talks, and some of them are because of the abnormal of the blood pipe. There are either it is genetically or congenitally malformed, or they have malformed because of various other causes. But in any case, it is the rupture of the blood pipe that causes the hemorrhagic stroke.
Sir, what could be different causes of strokes?
The causes of stroke, as I said, could be various reasons. You can say rather the risk factors, like who all are going to have the strokes. The risk factors per se lead on to the type of the stroke that we discussed. Either it is a diabetes, blood pressure, smoking, high cholesterol, sedentary lifestyle, smoking and other recreational medications with alcohol, and the genetically modified people, those who have genetic modifications, those who have bad blood pipes, can develop stroke.
So now that we have discussed the causes and risk factor of stroke, how can a person know he has a stroke, or what will be the symptoms of stroke?
Various organizations, stroke associations, American Heart Association, and WHO are promoting stroke identification as far as the common man is concerned, and there are lots of awareness going on. If somebody has got a stroke or not, how to know? You look at the face, look at the arm, look at the legs, look at the speech. Suppose a patient's face is little turned up to the one side, or the hand is weak or numb, or he's limping and is not able to walk, if his speech is getting slurred, or if they're getting suddenly unconscious for any reason, there's a possibility that probably patient has got a stroke. Now you need to see that these symptoms, if they are, you need to contact the emergency doctors at the earliest and reach to the hospital to the minimum period of time, because there are certain medications which can be given and that if the time is saved. If you look at it, if the patient's smile is getting turned to one side, the face is getting turned to the one side, sudden loss of vision, sudden loss of hearing, which happens abruptly, gives an indication that probably the patient is having a stroke.
Sir, at home, when the patient is having a stroke, as the patient may not be able to talk at that time, how do the patient's relatives or attendant know it is having a stroke, and what to do immediately at home?
As I said, if the patient is not able to speak or the speech is slurred, If the patient has got paralysis of the the other side, or the patient has become suddenly unconscious, as soon as you see the patient, he or she should be brought to the hospital emergency at the earliest. Take help of others. Uh, do not try to self-medicate, put water into their mouth, or try to do some of the activities at home which is not called for. And patients should reach to the emergency hospital because there are certain protocols which needs to be followed in such patients, and their life can be saved.
Sir, what are the treatment modalities at the time of when the patient gets into the emergency department?
Well, once the patient reaches to emergency, the stroke care team, the unit is there, but the team members have been trained accordingly to pick up the cases at the earliest, and they can be taken up for the various investigations at the earliest time, at the minimum short period of time, and then the patient can be sent for an investigation. Either it's a CT scan or MRI scan, which is mostly available right now in almost all the hospitals, at least a CT scan. And once you see the CT scan, you decide whether it's a clotting disease or a bleeding disease. And if it's a clotting disease, then there are certain criteria. If it fulfills, then patient can be taken up for a thrombolysis therapy, which is a life-saving measure. And if the patient reaches to the emergency, the team, which is well trained to maintain and manage such patients, which includes the anesthetist, radiologist, neurologist, neurosurgeons, the nursing team, the technicians team, the radiographer, they all are in the same sync. And once the patient comes, there's an intimation goes to all of them. They remain in a high alert mode and receive the patient to save the time.
Sir, we have heard about the stroke ICU. What is the stroke ICU and is it any difference from other ICUs?
It has been found out worldwide that if you have a stroke unit or stroke ICU, it is the nurses, technicians, doctors, residents, interns, and the specialists and consultants. They all are trained to manage and maintain the best critical care, best medical care to such patients. And it has definite evidences to suggest that the mortality rate and morbidity rate decreases if the patients of stroke are treated in a stroke ICU. They have certain facilities to monitor such patients. The staffs are trained to pick up these subtle signs and any kind of complications that arises. They can be monitored for their brain pressure. They can be monitored in the daily blood pressure, blood sugar, and the ventilation part. And all those things can be taken care of in a much more structured way in a stroke care unit, and that's how it gives the better result than the general ICU.
Sir, what are the treatment available for stroke and in focus with modern treatment facilities?
Like as I said, for the stroke, most of the things are in a hair in a patient who has got a stroke. Be it his blood pressure, which shoots up very fast, you need to control it. The blood sugar goes haywire. The sensorium is down, so the uh, patient is unconscious. You need to maintain the airway for such patients, and you need to maintain the blood lines so that the common fluids can be given. Besides that, the thrombolysis therapy I was discussing is the special medication which can be given to open up the clotted blood vessel, and that is a very time specific modality where actually the sooner you reach and sooner the treatment starts is better for the patient, and if they fulfill the criteria, then in such patients that medication can be applied. Secondly, if the patient is having a increase in the blood brain pressure because of the stroke, patient is unconscious, patient needs to be intubated, patient to be ventilated, and patients sometimes they require to put up a small channel by which the brain fluid can be removed to reduce the brain pressure, and sometimes the skull bone is removed to make the space for the brain to swell up in cases of stroke, because it suddenly rises and brain is inside the helmet like the bone, and it can't expand. So it compresses the main switch area, that's called the brainstem, and such procedures are being taken in patients of stroke.
Sir, now that we have discussed the treatment facilities, now how can we prevent such devastating condition as stroke?
See, as our ancestors used to say about simple living and high thinking, a very disciplined lifestyle, and you need to understand that the risk factors are, most of them are the sedentary lifestyle activities or the vices that I was talking about. So one needs to control his blood sugar, cholesterol, blood pressure, daily exercise, not taking too much of oily fatty foods, and not to be dependent on rich fatty food, protein foods, or the meat products. Too much of meat products are actually dangerous for the health. And second is the regular routine follow. In case somebody is having this kind of lifestyle diseases, they should continuously and meticulously follow the routine things to keep regularly to check themselves, and periodically they can see the tests to be done to see for the blood flow to the brain. The pipes are actually in the normal shape and size or not. How is about their heart rate? How is their blood pressure? How is the heart functioning? The blood pipes are actually working better or not? All these things needs to be taken care of having a better lifestyle. But the basic minimum is control your lifestyle diseases such as diabetes, blood pressure, cholesterol disease, and control your vices and have a disciplined life with exercise for at least 30 to 45 minutes, 5 days in a week.
Sir, what could be the rehabilitation measures after the stroke occurs?
Those who are not lucky enough to reach on time, those who have got a large, massive stroke with severe weakness or paralysis of one side, or in the altered sensorium of the unconscious state, such patients, when they recover, they have got lots of deficits. To prevent it, rehabilitation plays a major role. The speech therapy, physiotherapy, psychotherapy, and behavioral issues, occupational issues, they do come up in such patients. And the whole team of rehabilitation is a part and parcel of stroke care treatment, and they can be fine-tuned depending on the need of the patient. And they usually work on a biofeedback mechanism by which the patient, if the particular mode of exercise is being done, it gives a feedback to the brain that I need to do it, and that helps to regain. And second is the muscle power groups, those who are in our body, they have to be channelized in a way that they work in a coordinated manner, and physiotherapy rehabilitation is very essential and important for such patients. Thank you, sir. Thank you for your valuable time. It was a very informative discussion on brain stroke. I once again thank you, sir. Thanks.